All right, thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. And Britt, the host of close to 100 Love, Hope, Lyme podcast episodes. Hey, I want to let people know, even though we're going to be talking about Lyme disease today and related co-infections, this episode does not replace proper medical care. So if you're struggling with Lyme disease and related co-infections, please seek proper medical care. If you're watching this on YouTube, thank you so much. Give us a thumbs up. We would greatly appreciate it. If you're listening to this on Apple Podcasts, give us a 5-star review. We would greatly appreciate that as well. We're doing today's interview, Britt, in May of 2026. Of course, it's Lyme Disease Awareness Month, and there's a lot of things going on. I want to thank our listeners and viewers of the Love, Hope, Lyme podcast. Talking today with Britt Girvan, and she's the host of a new podcast called What the Morgs. And the Morgs is Morgellons or Morgellons. You and I discussed how it's properly pronounced during the prep. And either way, I think people will understand. Britt, first off, it's great to see you. How are you doing today?
Thank you so much for having me. I'm really excited to be here and to share my story about Morgellons, and also the podcast. So thank
All right,
you
very
so much
good.
for having me.
Yeah. So how many episodes have you posted so far?
So far we've posted 3
Mhm.
and have recorded quite a few more, but in the process of getting those edited and then getting those posted. So I think total I have under my belt so far is about 10.
Very good. That's great. Get started. And, they say if you've done more than 3 podcasts, you're a podcaster. So
Okay,
good for you. And I look forward to them being posted out there.
thank you.
So before you tell us a little bit about your story, for people who don't know, describe what Morgellons is so that people know. And then I'm curious about your story and would invite you to share whatever you'd like to share.
Well, so what I can tell you a little bit about Morgellons, unfortunately, there isn't a ton of research in our direction, so there are lots of different ideas about maybe what it is and what it isn't. I can tell you about my experience personally, um, but it is often described as, biting, stinging, crawling, sensations on the skin, and um, usually goes along with cognitive fog, joint pain, all the things that Lyme presents as well. So, what we know about Lyme patients, about 6% of Lyme patients have Morgellons, but that is roughly 98% of Morgellons patients that have Lyme.
Mm.
So that is, definitely the one major commonality. And then how it manifests in us. Obviously, we get, the longer we're undiagnosed, the more opportunity for co-infections. So for me, at my diagnosis, it was, Bartonella, Babesia, Borrelia, multiple genus species, subsets of those, plus parvovirus, Giardia, and
Mm.
then unfortunately Morgellons. And so for me, there was, terribly unusual things happening to my overall health and wellness, and I didn't understand what was happening. Um, but I had unusual fibers coming out of my skin. They
Mm.
were blue, they were red, actually mylar balloon material as well. It's interesting. My naturopath also has Lyme and Morgellons as well. And I remember when I first met her, and her sharing her story with me, to meet somebody else with something so unique was a gift. And then to have it be my clinician was even a greater gift. And then to share stories back and forth, honestly was quite valuable and healing for both of us. You don't meet lots of us every day. And So that was the onset, of the journey. I was diagnosed in January of 24. So I have been in solid treatment ever since and progressively getting better. I feel very fortunate in that what I now know is that Morgellons is wicked to treat. It is
Mm,
beyond challenging.
yeah.
Um, I am on a lot of support group sites, and what I see is, people treating, their Lyme, um, and the Morgellons is hanging on. Whereas for me, mine, as my Lyme and co-infections are dying, my Morgellons is leaving at a rapid clip, and I am beyond grateful. It would be excruciating, um, psychologically, to know that you are doing absolutely everything that you know to do, and you're still not healing.
Yeah.
I
So
can't imagine.
give us an insight. Is this a a constant thing, or does this kind of come and go, or does it only happen at night or when you're outside? Give us a peek into that.
Well, really good question. I think for everybody, it it is different. So to answer your questions, all the things that you just mentioned, that would be a yes, but not necessarily for me, only pieces of those. So for me, um, for me, um, it's every day. Um, but I am closer to being at the end. And kind of don't know how to describe how I know that, other than to describe I have less debris coming out of my body. The inflammation is down significantly. My cognitive fog is lifting. I'd say I'm at about 85%. In fact, the last time I talked to you, I'd say, I think I said to you I was 80%.
Yeah.
So I'm inching to remission. And so, having said that, I know that there are many patients that have attained remission, and but they still have to manage a clean lifestyle and mitigate stress, and hopefully have a supportive environment, seek additional clinical support if you need it in whatever area on your journey to overall health and wellness. But yeah, I actually was on a call this morning with a therapist back in Boston, and she has Lyme and Morgellons, and she manages it. Yes, she's in remission, but she works at it. She
Yeah.
works really hard at it. And so that was also good for me to hear, because I don't know when I get there what that's going to look like for me. I know that I'm going to continue the lifestyle that I have. It's working for me. Um, so, um, yeah, I don't want any do-overs. I'm not interested in doing this again. So, I would like to think that moving forward, I can attain at least as close to full remission as possible.
Yeah. So, when you say things are coming out of your body, what does that look like? Is it all through your body in various places? Is it sweat? Is it pus-like? What does this look like?
So again,
Whatever
for
you want to share.
everybody, very different. For me, it's my face, which is pretty common. A lot of bacteria and whatnot gets stuck, kind of in the sinus area. Um, I think for me, what sent my system over the edge, I suspect I've had Lyme for about 10 years, possibly more. And But my lifestyle, a lot of working out, a lot of yoga, a lot of clean eating, it's just something that have always done. And I think that in looking back, there was strange things happening to my body, but I didn't understand. But I think what I was doing is really mitigating a full-blown um, Lyme episode. And so it wasn't until the pandemic was introduced. So not only the pandemic, so
Yeah.
COVID itself, the vaccine,
Mm.
um, a furlough at
Yeah.
employment. And then during that time, I lost my mom, my stepmom, my ex-husband, my ex-brother, my ex-mother-in-law, a dear friend to cancer, and then my best friend was diagnosed with colorectal cancer.
Mm.
And that sent my system into orbit. And so for me, um, I have a lot of blue plastic coming out of my body.
Mm.
Mhm. They're little round dots.
Mm.
I have black fibers. For the most part, those are hairs. I'm very much past the funkier early stage. The early
Mm.
stage, it was very questionable what was coming out, but obviously a lot of skin. As the Lyme and Morgellons started to die, like I wash my face and it feels like I'm washing my face with pebbles and it
Mm.
feels like shards of glass. And it's my understanding it's the keratin that is kind of crystallized at this
Mm.
point, but that's more towards the end. In the beginning, when it hadn't died, it was different. But I use a lot of salt. For healing,
Mm.
not only in my baths. My baths are generally a cup of Epsom salt, a cup of borax, a cup of hydrogen peroxide,
Mm.
and a cup of baking soda.
Wow.
And that is quite soothing, but obviously draws out a lot of impurities out of our bodies. So you generally want to have it as hot as you can, and you really want to stay in there as long as you can. But yeah, I also got to a point, and I am sure that other Morgellons sufferers feel the same. I mean, walking away from the rituals was imperative at one point because it's so consuming, Morgellons is,
Mhm.
and the quality of our life is pretty mitigated.
Yeah.
And I just I had to start walking away from, say, 3 showers a day or
Mm.
4 baths a day. It's not a life, it's not living.
Wow.
And so to sort of walk away from those rituals was really important. Every time I get in the bath to this day, I literally say to myself, I'm still sick.
Mm.
And you know, I can't wait for the day that I
Yeah.
don't have to, it's not imperative. I
Yeah,
don't,
I have a question for you. So, one of the challenges that everybody listening knows about Lyme disease is that testing is very challenging, and there are very few tests for related co-infections to make it even more challenging. And we've covered this on various shows. Is there a test for Morgellons, or is it something that is, like Dr. Horowitz has his famous checklist? Is there a checklist? Like if you have these six things, does every would a G? I mean, one of the challenges too is that not every GP or emergency room doctor or infectious disease doctor even believes that chronic Lyme exists or is aware of how to search for Lyme. Where does Morgellons fit into that equation?
um, to my knowledge, there isn't a checklist. Um, I think, from my own experience, when I had my first 90-minute consultation and started describing my symptoms, the what was stated to me was, I suspect you have something called Morgellons. Do you
Mm.
know what that is? And then they cautioned me that, Britt, this is real, but unfortunately, it's not going to be recognized. These are the sites that you want to go to for support, but we're here to support you. So it was more or less, describing what was coming out of my body and as far as it relates to the fibers and the hairs and things like that. People have a whole host of organisms that come out of their body. I didn't have that necessarily. Mine just looked a little different, but there are very unsavory, questionable things coming out of people's bodies.
Wow. So you created a podcast called the What the Morgs podcast. You've posted about 15 shows at this point. Why did you get started with that? And what are you hoping to achieve with it?
Well, I still can't believe I'm doing it, but I
Oh,
am,
good.
and
Good.
I'm grateful. I intend for this to heal me in ways that I can't wait. Um, but you know, two things. Every time I go on to the support group site, usually somebody's sharing a specimen of something that came off of their body, and usually it's what the blank. And so I thought, okay, why don't we name it What the Morgs and create a safe space. I don't know where the statistic came from, but it's my understanding that Morgellons patients are 800 times more likely to commit suicide. And it is a very current topic of discussion on our sites. And we are regularly talking people off the ledge from taking their own life. So many folks have, um, obviously the medical community has turned their back. Unfortunately, oftentimes partners can't align with, say, a naturopathic perspective versus an allopathic perspective. So they demand the allopathic perspective, but don't understand that those tests are grossly negligent. And they're losing their families, losing their jobs, and again, going back to quality of life, our quality of life is really challenged. And for those people who lack resources, meaning financial resources, it's going to make it even that much more challenging on their way to overall health and wellness. But those were the main reasons. There was a period where every time I went on, it was it was just I can't do this anymore. I can't. Please help. And obviously everybody comes and supports and stuff, but um I I knew that starting this as well would it's controversial and I'm sure that I'll be called all sorts of things and it's okay. I know my truth. I know my experience. And ultimately my goal is to change policy. That's what I want. We demand to
Yeah.
be seen. This is crimes against humanity. This is awful. Medical malpractice, just it's horrific.
Absolutely. We've talked a lot about that on the Love Hope Line podcast. So what are you going to be talking about on the show? Are you going to be interviewing people with Morgellons about what they're doing? Is that your primary guest? Or I know in your first episode you had a doctor who kind of talked a little more detail about what Morgellons is. So where are you looking to go with the show and who are you trying to bring on to the show?
Thank you for asking. Great question. So, um, I would like to stay currently in the clinical lane. So I am inviting as many clinical folks as possible, research, direct care. I don't care what capacity, but um, um, so that so far is my lane. And once I've sort of gotten at least I think I have about 15 of those folks that I've kind of earmarked, then yes, I'm going to start reaching out to patients and I'm really hopeful that maybe some would be willing to share their story. I know it's scary. I get it. um I'm doing it. So hopefully they feel safe,
Yeah.
that's what I hope.
Well, once again, congratulations again on taking the bold step. There's people who as I tell people, and I think I told you, if one person listens to your podcast, then one person listens to your podcast, and hopefully it's going to change. Now we want hundreds and thousands to listen, but yeah, you took the step out there, and I think it's going to be helpful for a lot of people. Matter of fact, I've actually, again, we're approaching our 100th episode of the Love Hope Line podcast, and I've had a couple people reach out and asking me to do a show on Morgellons, and I wasn't quite sure who to ask, and I didn't really know much about it. And like you said a couple times during today's interview with Britt Girvan, it might be controversial, and it's a there's so many niches within the Lyme disease world, and there's so many. Of course, every co-infection could have its own story. Matter of fact, I was in an event yesterday, and we're doing today's interview in May of 2026. I was at a scientific event yesterday with someone who's developing a very powerful test for Lyme, and it was great. And then they said, and then we're going to move on to co-infections. And that's great too in 2026, that we're still addressing the fact that we need to be doing more things for the Bartonellas and Babesia survivors as well. So I applaud you. I wish you well. Continue doing it. Thank you for sharing your story. Is there any final thoughts, anything specific that you want to get across to either other workouts? And by the way, one thing you mentioned before, one of the reasons, the primary reason I wrote my book, Love, Hope, Lyme, is when I decided to learn more about what someone once in my life was going through. I had a lot of people who reached out to me and said, nobody cares. My family doesn't believe me. Someone said, and I've stated this a couple times on the podcast, 75% of relationships will end if chronic Lyme is in the equation. And 90% of the time it's the spouse who says, I'm out of here. I don't believe you. You don't look sick. All those things that people listening to my show are like you are nodding right now. So I can definitely relate to that. So give us a couple final thoughts here. Anything you want to leave us with?
For my community, um, I hope it brings some hope to them, honestly. I really do. I hope that for those that feel just desperate, that this may shine a little light, maybe just expose a smidge, and that I'm not an expert. One of the ways that Lyme and the co-infections have affected me personally is my cognition. And so I would say only in the last 6 months has it lifted enough to be able to function, even at this level and, participate in podcasts. Um, but that, um, I when I got this diagnosis, I could only do anything audible, but even then my brain was so inflamed that I could only retain so much. And so I hope that they understand that I'm not an expert. I am an expert about my own experience, but what I intend to do is to provide a safe space and platform, and provide hope to the Morgellons population.
Absolutely. One of the reasons why I keep doing the Love Hope Line podcast is to, like you, hopefully bring community a hope to a community that needs it. All right. Once again, I want to thank Britt Girvan. Best of luck on your new podcast. What the Morgs? Thank you very much for sharing your story here. My name is Fred Diamond, and this is the Love Hope Lyme podcast.